We are facing different challenges in lives, especially shortage of land. You find a man has 6 wives, so a big family, making a big family like 30 children. So you find all children, they are not having enough land to live. We are losing a lot of cows. They are dying due to the drought. So you find that people are not happy. Here, the real problem is water.
We came here to Esilalei with a team of Esilalei to discuss with the Maasai what can we do. We found out during those discussions that everyone is supporting the idea of we need to start birth control in our area to reduce the number of future kids because we can't feed them anymore. And even the elders, although they are very traditional, they were really supporting the idea. So we do the interview to get information from the Maasai about their use of contraceptives, but also their knowledge. What do they know about contraceptives? What we basically want is to increase dialogue between Maasai and healthcare to improve use and knowledge of contraceptives.
Most of the Maasai, they live in tradition. As they live tradition, you find they like to have 3 to 4 wives and many children.
Also, we collect other information from there, which is about the family situation, how many wives, how many children, but also how many pregnancies and maybe how many children have died or how many pregnancies failed, to get a clear view also about some other reproductive health issues. What we see is some women, they know what we're talking about. Others, they are totally blind. They have no idea. Even their knowledge about pregnancy, how do you get pregnant and so on, is still very limited.
Without plan, you can have many children, and you find the woman, nothing can stop for breeding.
Wanaume wetu wanaoa. Boma inakuwa kubwa. Mtu anaoa 10. Ama cha uzazi wa mpango. Uzazi wa mpango ajue anazaa watoto kwa hata 13. Unawazaa wengi hawaendi shule, wanabaki.
Ore nigro beliana na ilimado wala para moruaka. Pagomba do bangara yana la yibe asida yala yenu na rangolo yukumu. Na bosie beraro moru jarka senara ngolo yukumu. Aure ni arankara kumu.
We are currently going to the hospital to collect data on contraceptive use and prescription of family planning.
The most problem is language, not enough education, family planning. They don't use because of the traditional beliefs.
Amana rara meyolo ya mani ga ndasa rendwa mani ga ndasa rendwa nara enare no no ya ga yedo na vela yo sidana yole na ndana na winga basi.
Mobile phone use really is an opportunity to increase that dialogue between Maasai and healthcare on family planning. Currently, around 80% of Tanzanians use a mobile phone. They have covered almost all of the areas now.
So the technology we are going to use, it's called interactive voice response calling. They can select the menu of the content by speaking a certain keyword. Can I know about condom, for instance? The use of the condom. That will be easier for them to navigate and get the required information on the proper time.
We are doing a pilot study now, meaning we are just doing it in Esilalei ward among 62 couples who are being interviewed now. Then they will use the system, then we will interview them again to see if there is a difference. If we find that our system that we're going to develop, the mHealth platform, if it will improve the knowledge and use of contraceptives, or at least increase dialogue between Masaai and healthcare on use of contraceptives, then the Masaai of Esilalei ward will be ambassadors for spreading the news, for expanding the system.
We give them education, and through that education they can know about contraceptive method. I have 2 children now. I'm not trying to have many children.
Currently, the system will only focus on family planning, but it might later also include other issues of reproductive health which play a role among Masaai, such as preventing sexually transmitted infections, including HIV, and such as, for example, a sensitive topic of female genital mutilation or female circumcision.
Let us change, let us step out about having many wives, and try to help you, try to empower your children to have to get education, so they will enjoy a little. They will not be suffering, walking around. No, they will change, and then they will have good life.